Thank you for coming. I want to thank Yolanda for being here as well. She's always here for us to make sure we get the message out as many different ways as we can. I think everyone knows right now that safety and student protection and our employee protection has always been the top of our list. It continues. Part of what we did with the CARES Act from the federal government this year, we wrote in it that we would hire I'm going to say the term guru to guide us through this COVID uncharted territory that we're in. I'm very excited that we were able to hire someone with a lot of pediatric experience, a very qualified person, a nurse, medical professional, all kinds of accolades and experience. But what we wanted to do was have someone that our administrators could reach out to directly immediately when they have any COVID questions. That would also be the conduit between us and the Department of Health and PanCare. We have great partnerships with PanCare and the Department of Health, but I think everyone knows that dealing with multiple health agencies and following the CDC guidelines is going to be a challenge. It's going to be a challenge for all of us. It's been a challenge for all of us since March. And so having someone on staff like this that is paid for by the federal government in that grant is going to allow those administrators and directors to have someone to reach out to when they have a question that needs an immediate answer, what to do, how to react, what to tell a parent, what to tell students. And so Lindsay is a mom to 3 or 4 kids.
4.
I thought it was 4, but I didn't. Yeah, 4 children. So she has a vested interest in this too because her children are going to be a part of our school system. And I have no doubt that being the professional she is, that I've come to enjoy listening to and watching what she's done already in this short time, that she's going to fill a big void for us and help us get through this time of uncertainty and limited knowledge, bringing her wealth of knowledge to us. So with that, I'd like to introduce you to Lindsay Jackson. Come on up here, Lindsay. Lindsay, Yolanda, Lindsay.
Hello. Hello, my name is Lindsay Jackson, and I'm excited to be a part of Bay District Schools. I am working very closely with the Bay County Department of Health to follow current CDC guidelines. I'm working with school administrators to identify possible cases of COVID-19 and to help get their staff and their household family members tested so that we can keep track of these situations, monitor for trends, and make these close decisions with the Department of Health to keep our students and our staff safe and healthy. I participate in weekly school health phone calls, actually twice a week, and these calls serve to keep us up to date on current CDC guidelines, and they also help us to obtain answers to questions directly from physicians and epidemiologists within the Department of Health. So we are really working as a strong team to keep everyone safe, healthy, and informed.
So will you be located here at the district? Will be your office?
Yes. Mm-hmm.
And then I know 3 teachers tested positive earlier this week. Is that number still accurate today?
As far as I know, that's accurate.
Yeah. So when it comes to that whole opening up back to schools, how are you guys going to go about testing students and whatnot to see if they're positive?
Okay, so at the schools that have the health clinics, the telehealth clinics, they will be able to have the rapid test results through PanCare. And so the students will be screened in the health room, and if they have symptoms of COVID-19, they will be isolated, they will be tested. They can also rule out other easily diagnosable situations. And then if that student is suspected to have COVID-19, they will be sent home and asked to isolate. And then the Department of Health will work with that family to perform contact tracing and identify anyone who could have been in contact with that student. And then the Department of Health will work with us to help us decide what's the next step.
So it won't be like the whole classroom, goes home that day.
It's just, it's a situation where we have to really take it on a case-by-case basis because everything is different. There are some classroom situations where students are working really closely together, and there are other situations where they're able to socially distance more. And so this is really a situation where the Department of Health is going to guide us, and they're really working closely with us and being very helpful.
Okay. And so when it comes to checking the students just to get them tested, is it going to be like a weekly testing, or is it just going to be kind of a volunteer basis? How is that going to work?
So the CDC and the Department of Health are not recommending, daily testing or weekly testing on a schedule. It's just on a symptomatic basis. If
Are
you're
you talking
symptomatic.
how does the test
Oh,
take, I think?
I'm sorry. Okay, so the rapid test will be back in 15 minutes.
I was actually to that.
You want both?
You want both? Okay. Okay.
Okay, you're doing good.
Did I answer yet?
Yeah.
Okay. All right. Anything else?
Yeah, is there anything else that you want the community and parents to know as we prepare for this upcoming school year?
So really, if we can all work together and follow the guidelines by the CDC of social distancing, wearing masks, washing our hands, self-monitoring on a daily basis, do I have symptoms? Do I have a low-grade fever? Do I have a fever of 100.4 or higher? And really being aware of those things, then we can get through this together. We can all look out for each other and keep each other as healthy and safe as possible so we can have a great start to the school year.
Oh yeah, also I know you said that you'll be having a weekly call. Weekly call, that's going to be almost all the schools.
It's actually twice a week. It's Mondays and Wednesdays. I log in and they offer up-to-date information and answer questions that have been sent in from different individuals.
Okay, what about parents and all them have questions? Do they go directly to the school? Can they contact you? How are they going about that?
So parents can contact the Department of Health. They can also, if their individual school has a nurse assigned to their school, they can work with them. And then I'm also working with administrators. So if there's a concern that's brought up to a school administrator, then I can help answer that question so that they can disseminate that amongst their individual school.
Earlier we shared some information with employees about how to wear a mask and what to do, and so we thought maybe the superintendent would do that demo for you guys.
Thank you so much.
Well, I did have one more question.
Sure.
Did you answer a question about as far as teachers when it comes to staff being tested as well as that?
Yes, so PanCare has opened up a site for us at Gulf Coast State College that is available to staff and their household family members. And so I am working with them to get them scheduled. And those are on Tuesdays, Thursdays, and Saturdays. And they get their rapid results within the 15 to 20 minutes. And then they are to notify their administrator so that we can be sure that if we're having any trends, we can work on that quickly.
So are they supposed to be routinely tested?
Only if they have symptoms.
Okay.
Yeah.
So it's all things. Okay.
Yeah.
Thank you.
Uh-huh. Thank you.
Let me also add to that each school will have two health techs this year. We've worked with PanCare to make sure that we always had a health tech. Now we added another one that's going to be specifically or mainly working with COVID symptom individuals on campus. And that's very important that we do that because we want to catch it early if it's there. And you mentioned something about 3 people having it. We've had employees all summer that have had this. I mean, you've got to realize that we're the largest employer in Bay County. We had 4,000 employees the last time we were actually open for business. We're the largest employer in Bay County, so the percentage of employees that we have that are going to have COVID are going to be right in line with the whole community. And so, the sadness of this is that there have been people in this community, in this state, in this country, in this world that are dying from this. And we understand that, but we also understand some of the things that can be done to prevent that. And one of the big things that we have talked to our employees about, our administrators, and we're going to talk to the students more and more, is about the mask protocol. And you put it on like this, and you don't put your hands on the face. That's the thing that you can't do because it defeats the purpose of wearing the mask. So I talked to, we're sharing a video soon with all of our employees about the 3 main things I think they can do, and Lindsay knows a lot more than I do, but wearing the mask, washing your hands regularly, and using hand sanitizer, keeping that social distancing. I mean, that's the key to this. And so what I'm asking our employees to do is to be careful and not let their guard down. When you let your guard down, that's when you're most susceptible. And so don't assume that somebody in the workroom or somebody in the front office is safe. Now, they might be, but somebody that came into their house or in their life might not be. And so we're just trying to prepare everybody. We know that these cases are not going to go away. If anybody thinks this is going to stop, they're wrong. This is not going to stop. People are going to continue to get this virus. Everyone that I know that I've personally dealt with, family and friends that have got it, have already recovered from it. I've got 2 new friends, or 2 friends that just recently got it, and they seem fine. I've been talking with them. And so we know that this virus is not going to go away. We're going to be dealing with this for, it could be a year or 2. I've even read where we might never find a cure for this. So I think it's very important that we need to be careful about what we do, social distancing, wearing a mask, and keeping our hands clean, and keeping our hands away from our face. That's going to be the hard thing to do for many people. But with that, unless you have some questions, I think we're done. Tony has a question. I'm going to let him go first. See, I got great peripheral vision. I saw him over there.
You talked about having additional health tech in all the schools for COVID-related issues. Talk about how important it is to have somebody like Lindsay as kind of like the main direct point of contact in the district to deal with COVID.
Well, and see, the health techs work for Pancare, so they have medical professionals they can reach just like that. But our administrators and our directors need someone on our team that they feel like they can go to right away when they have a COVID question. And so that's where Lindsay's going to come in. Lindsay's going to be that person that we're all going to start talking, okay, Lindsay, this situation's going on, what do we need to do? She'll be in constant contact with the health department, and then while Lindsay works for us, she's going to be guided by the health department. Lindsay's not going to do anything that the health department's not already said that's what she should do or this is what we should do. And so that's the neat part about having someone that speaks that language. You heard her throw out epidemiology out there when she was talking to me. Don't ask me to spell it. I know how to say it now, but don't ask me to spell it. But we've got to have these kind of people on our team so that we can speak that language and so that our administrators can find someone right away to get an answer to a problem or situation so it doesn't lag. And I'm not trying to scare people when I say this isn't going to go away, but we're living in the real world, guys. This COVID virus is not going to stop. We're going to continue to deal with this for some time to come. And so the best way to do that is know how to prevent it when you can and know who to talk to when you have questions. And I think we're covering both of those the best we can. Now you had a question.
How will the school district as a total handle these absences, whether it be teachers or students?
Well, teachers have a great sick leave program that we have, and we're still in negotiation with the teachers, with the union on how we're going to do that. And students, if they're sick, stay home. We've always said that, even before COVID existed. Don't bring your cold to school. Don't bring your flu to school. Stay home when you're sick. I mean, and that's a strong message. We don't want students coming to school when they're sick. We didn't want them before COVID, and we certainly don't want them now. And so we want you to stay home. And Baylink kind of helps us with that. If you have a long-term illness, if someone in your family has it and you're having to self-isolate and you're an older student, and you can now be able to use Baylink to keep up with your work and find out what you're missing. So, I mean, that added another layer of help in there for students and families.
For those teachers, if they do have to take a leave of absence, they need to use their sick days. Will they be paid during that time, or is that still?
They have sick leave that they can use any way they want in personal leave, and we're still negotiating. But there's also the federal law has 2 weeks of pay that they're allowed to have if they need that. That we actually pay, but there's a 2-week allowance that is in there by federal law that they're allowed to have as well.
And also you could address Baylink and how teachers can teach from home.
Yeah, and if a teacher's not sick but has to isolate or has to take care of their child or something, they could use Baylink to be a teacher from home. And some teachers are going to do that. We think that was another reason why the union jumped on that option, because it does benefit teachers in lower ratio of students to teachers in the classroom. And it does offer some teachers an opportunity to teach from home when they have to. Okay?
And then what are the staffing concerns if multiple employees catch this?
Well, I mean, to be very candid with you, I've been doing this 38 years, and we've run with the flu, and we've had big-time numbers out with people with the flu, and we've just continued on. And I think it's going to be like that if it gets to that point. Teachers are great about helping each other. Administrators know how to deal with those situations when they have multiple people out at one time. And I think that's what we'll all be doing. We'll all be pitching in. I know one of your TV stations had a couple reporters out and somebody else had to cover for them. I mean, that's what you did. I think that's what the whole world's doing right now. And so we're going to have to take care of each other and cover for each other. I mean, every business is doing that right now, and we're going to be no different. You didn't. I saw you move, but I didn't see the hand go up. Thank you, Yo-Yo. She did a great job.
Thank you.
All right. Thank y'all very much.
Star of the show.
She always is. Lindsay, good job. Thank you.